Welcome, everybody, to Better with Age podcast number 2. I have the great privilege and honor today to be talking with Dr. Susan Gross, who I get to call a colleague and a friend. I hope you enjoy our conversation as much as I expect to. Dr. Gross has been working for almost 42 years in dentistry and has seen a lot of changes in the field. And one of the things that I so admire about her is that she continues to learn and grow even towards the 4th decade of her career, which is very impressive. So welcome, Dr. Gross. Thanks so much for sitting down with me and taking some time to chat.
My pleasure.
Well, maybe just get started and share a little bit about yourself and your journey to where you are now.
Well, I'm a lifelong learner, and I am constantly trying to learn and grow with the expanding body of knowledge out there. I have lived in Minnesota my entire life. I grew up in St. Paul, and I attended dental school at the University of Minnesota right here. And I've been in private practice, like Galen, like you said, for over 40 years right here in St. Louis Park, Minnesota. For the past 4 years, I've been in practice together with my colleague and my friend, Dr. Maria Miller-Rinaldi. We decided to collaborate and practice together because of similar philosophies that we had centered around individualized patient care. And we're passionate about integrating dentistry with the whole person. The name of the practice is Root Cause Integrative Dental Medicine. And our philosophy of care is not just to treat symptoms, but to identify and hopefully resolve root causes of health problems so chronic diseases are no longer chronic. We like to look at red flags and risks for each individual person so that we can partner with our patients and maybe hopefully prevent many health problems. We believe in collaboration with patients, other practitioners such as Galen, for the best care. So we appreciate being able to walk as partners with patients in their journey for good health.
That's awesome. Well, I think it's been said by some that really the first line of defense for health overall starts in the mouth. And I think your role, I don't know if we'd call it gatekeeper, but you
It
get to
is,
see
yeah.
things from such a different angle, I guess, or a lens or perspective, which
Mhm.
a lot of other providers maybe aren't able to see that. So I
Yeah.
certainly appreciate the work that you do for sure. So talk a little bit about maybe your why, what has really sparked this as a passion for you, not just a job, but why do you
Yeah.
do what you do? Why do you continue to have so much energy and vitality in working with your patients?
Well, I started out my practice in dentistry already being interested in overall health. Prior to dentistry, I was a medical technologist, and I worked at a hospital analyzing blood work. And I thought I really wanted to be involved with more direct patient care, not just looking at the blood work. I wanted to know, what was the person behind it. So that's why I went into dentistry. And then go back, 40 some years ago, I don't know what happened along the way in medicine, but the head kind of became disconnected from the rest of the body.
Mm,
And dental practitioners, we'd be called in if a patient's oral health was questionable when it came to an acute situation like, oh, you better have good oral health if you for an upcoming bone marrow transplant or a liver transplant, or if somebody had a serious infection around the heart valves, it was understood that oral health could impact these things. But other than that, it was like separate.
Mm.
And I just kept being curious and seeking to learn with and from other like-minded healthcare practitioners and trying to identify shifts in people's health earlier. Maybe asking, why do we wait for a certain threshold of a number of a disease to be able to treat it? Why can't we look at healthcare as health as a continuum and intervene sooner, or maybe never have to intervene? And so I was very interested in all of this and very focused and curious about it. But then, of course, I had been personally, a little personal story. I had been enjoying a family function, having a good time, talking with somebody, and my retina detached in my left eye. And fortunate for me, I was able to have surgery quickly. Thank goodness for the skilled surgeons and the technology, and restored. And I'm a dentist, so I can assure you my eyesight is perfect. But then I was told, well, it's just one of those things, kind of a fluke. And then 2 years later, same thing happened, but this time on the other eye. And I was told, well, you're getting older. And I'm like, but really, there's a lot of people my age that don't have detached retinas.
Right.
And so I thought, again, thank goodness for the skilled surgeons, technology available to be able to restore my eyesight to perfect. But it's then when I really started to dig deep into learning all I could about the connections in the body and systemic health and searching for underlying root causes for myself and for my patients. And the problems, what I found out is that the problems with the small vessels and nerves in my retinas, they were just warning signs of systemic problems.
Mm-hmm.
So it's kind of, a personal story as well as just a broad lens of looking at patients over time too.
Yeah, that's great. I certainly appreciate the story. Well, let's jump into some of these connections. So, just generally speaking, let's talk about the connection between oral health and overall health. And certainly, there have been volumes of books that have been written about this. But for somebody that maybe is not sure where we're going with this, or this might be a new concept to them,
Mm-hmm.
how would you simplify this idea of how our oral health is related to our overall health?
So what I have to say, it could be said in one sentence, but I will elaborate. I say that oral health is systemic health.
Mm,
The mouth is the gateway, like you said earlier, to the rest of the body. It's the entry point of the GI system. One end affects the other. Um, I've been known to say frequently that I've never seen any teeth walking into my office without the rest of the whole person. There's so many vital connections between the oral health and the body. Nearly 80% of American adults over the age of 35 have some form of gum inflammation or gum disease.
mm,
Um, and the blood vessels in the gum tissues are part of your cardiovascular system. And some of pathogenic bacteria that cause gum disease can enter into the bloodstream. They can be swallowed, they can be inhaled. Gum disease is associated with Alzheimer's disease, cognitive decline, all forms of cardiovascular inflammation and cardiovascular disease, lung infections, associations with cancer, diabetes, rheumatoid arthritis, GI issues. 95% of those with diabetes also have gum disease, making blood sugar control more difficult. The relationship actually of gum disease and diabetes is considered, we call it bidirectional, in that one affects the other. So when we see a patient with diabetes, we are carefully observing, monitoring, and when necessary, treating any gum disease issues. And in order to ensure metabolic health, the gums have to be healthy, and in order to ensure metabolic health. So it's bi-directional. Both need to be addressed together. So that's just some examples. Some dermatological conditions that appear on the skin actually also can appear in the mouth. And sometimes we are alerted to some of these because of some of the changes we see in people's mouths, in the tissues and things. So does that answer kind of a basic overview of some of the connections?
Yeah, I mean, I just want to make sure that I heard you right. You said 80% of Americans over the age of 35 have some form of gum disease?
Right. And
Wow.
and that's a continuum, just like anything.
Sure.
Gum disease starts with some inflammation and bleeding. Um, it can be reversible at that point in time, but the minute we start getting bone loss and gum recession, then some of that attachment is not able to be grown back. We can stop progression. And we've been finding that um, there's pathogenic bacteria. There's a shift in the microbiome in the mouth
Mm.
that will turn like a healthy microbiome into a more diseased state. And when that occurs, then those pathogens can make their way into the circulatory system. They can locally cause problems with bone loss and gum recession.
Wow, that's amazing. For people that are maybe listening to this and thinking with wide eyes and maybe a little pit in their stomach, am I in that 80% of
Yeah.
people that have gum disease? What would you say are maybe your top two or three or four things that folks can do maybe in the 35 to 50-year-old age range that they can do for themselves to help either prevent gum disease or maybe pull themselves back from something they may not even know is happening?
Well, the sign of bleeding in the gums, even a little bit, is not normal.
Hmm.
And I've heard people say, if you scratched your eye and it started to bleed, you would know right away that's not normal. And the same thing in the mouth. Any amount of bleeding can be a sign of inflammation. And so I think attention to even just a little bit of bleeding is something that is important, and to have the gum tissues checked, and not and again, where are you on that continuum? Is it a place where things can be reversed, or is it a place where things can be kept from getting worse?
Sure.
Yeah.
So, assuming brushing after meals, flossing after meals, regular dental checkups, are there any other things that people can do that maybe aren't as obvious or aren't as widely publicized to
Yeah.
help with gum health?
Well, this is where I feel like less is more,
Hmm.
because you know it's interesting. There's some general recommendations that I'm going to make in a minute, but for the most part, recommendations need to be really specific for each person, really down to the products that people use for their oral health.
Hmm.
For example, many people use over-the-counter mouth rinses, and they're advertised to kill 99% of germs. Well, the problem is that they do kill too many. They
Right.
kill both the good bacteria and the bad bacteria. And for many people, the use of the over-the-counter mouth rinses can actually shift the microbiome into a more unhealthy situation. And these bacteria can change the metabolism of the bacteria in the mouth. And actually, the good bacteria is necessary in regulating blood pressure.
Hmm.
So it's amazing. Studies have been done to show that stopping the use of some over-the-counter mouth rinses in some people actually will improve the blood pressure because we need the good bacteria. The metabolism of the good bacteria helps release nitric oxide, which opens up blood vessels and helps blood pressure. So when we kill too many bacteria and the bad bacteria take over, then we can have some raising of blood pressure.
Wow, that's super interesting.
Yeah, and so a lot of times people think, well, I will just use, this product and layer on this product and layer on this product. And we've really gotten away from not recommending products. It all kind of depends which bacteria is in your mouth. Are we trying to eliminate some of the pathogenic ones? Are we trying to keep encouraging the good ones to grow?
Interesting. I'm wondering now, is there any relationship to people who drink alcohol to microbiome within the mouth? Would that have similar effects? Obviously, probably lower levels of alcohol, but has
Mhm.
that been shown to
I
impact
I don't
somebody's oral
know. I
microbiome?
don't know of any studies that show that the direct ingestion of the alcohol on contact is causing a problem. Of course, alcohol consumption will play havoc with oftentimes with inflammation and inflammation in the body. Alcohol can, if it's consumed anywhere around, going to bed, it can play havoc with sleep.
Sure.
But I don't know of any studies of just the on contact effect. I know that alcohol, as well as smoking, increases oral cancer risk.
Hmm. Well, I'm sure there'd be plenty of people lining up to do that study if there are some beers in it for them. I'm guessing they might be willing to do that.
And chronic use may be more of a problem than, now and then.
Of course. Yeah, absolutely. Well, let's talk about, are there any specific links between, let's say, oral health and osteoporosis, for example, bone health?
Um, that's a really good topic to talk about in a population, maybe, over 60, because we spend a lot of time talking with our patients about this. Osteoporosis is generally diagnosed with a bone scan of the hips and the lower spine. And a diagnosis is made if there's some loss in density, and some recommendations sometimes are made to help try to decrease a person's risk of having fractures. But however, osteoporosis affects all bones in the body,
Hmm.
and the upper and lower jaw bones included. So if a person is diagnosed with osteoporosis or osteopenia and medications are prescribed, it's important to discuss this with your dentist and have your dentist collaborate with your medical professional prior to starting any sort of medication or treatment. Some of these medications actually can pose some risks to the jawbone, especially if there's future oral surgery that's needed, such as a tooth extraction or an implant placement and things like that. So it's best to achieve optimal oral health prior to starting any of the many medications used for osteoporosis, and continue to maintain optimal oral health while taking these medications and even for years after. Some of these medications can stay in a person's system for many years. So the effects of building the bone are there for more years, but sometimes then some potential side effects. Now, granted, some of these risks are somewhat rare, but they are definitely part of the consideration in if a person is on these medications and needs any sort of oral surgery.
Sure. Just curious, there certainly is a wealth of research about the benefits of resistance training for bones in the body. Is that true also for the bones of the jaw? Are there any studies that have looked at maybe resistance chewing or any sort of exercise related modalities to help improve uh, bone density in that area?
Well, it's interesting. that's something I'm going to have to look up as far as building back bone density. But anthropologically, there's been studies of the human jaw structure just over the last 50, 60 years. And with the introduction of processed foods and more soft foods and things like that, there actually has been a change in jaw structure. People's jaws are narrower, and it's related to not doing chewing and chewing motion, especially
Mm-hmm.
during growth and development. And so, with that information moving ahead in life, I don't know about studies that show that resistance type training and more chewing in adults is helpful. Um, but it's an interesting concept, especially because we know the changes that have been made because in growth and development of infants through the mature growth, that the jaw structure actually has changed.
Well, I bet if that's the case, the beef jerky industry would be all about it. They would
Well,
be throwing that out
absolutely.
there as a potential
Absolutely. And
benefit.
and there may be studies about this, and I'm real curious now to investigate.
Sure. Yeah, I think that's awesome. Let's talk about relationships between oral health and brain health.
So it's really interesting. A lot of previous thought was that some of the oral bacteria, that they don't cross the blood-brain barrier, and the same thing about pregnancy, they don't cross the placenta. But research has shown that some of the pathogenic oral bacteria make their way into these places. And so it's really interesting to find out that people that have been suffering from gum disease actually have an increased risk of cognitive decline and dementia.
Hmm.
And so, and Alzheimer's. And so there are findings of these pathogenic bacteria in the brain.
Wow.
And then also, as related to brain health and oral health, it's also brain health is very much affected by obstructive sleep apnea. And when sleep apnea occurs, it's an obstruction in the pharyngeal area, nasal area. So that's oral health as well. And so sleep apnea or sleep disturbed breathing, sleep fragmentation, not getting enough oxygen or not getting enough deep or REM sleep can seriously affect brain health, as well as many other systems in the body. But when we are in deep and REM sleep, our brains are cleansed. And so it's important to have good sleep quality. And then also, if a person is desaturating from oxygen deprivation during obstructive sleep apnea, then they're not getting enough brain oxygen to the brain as
Hmm.
well as other vital organs.
Sure.
So brain health is really could be very much affected by sleep apnea as well.
Yeah, I want to go back to a point that you brought up just a moment ago. So you talked about there's evidence of this pathogenic bacteria in the brain. So are these folks that have initially been diagnosed with Alzheimer's and dementia, and then they happen to get some sort of scan, or I guess I'm not even sure what the test
It's
would
it's
be?
been it's been analysis of brains of people that have passed away
Postmortem, sure.
and postmortem, and then there's people with dementia, cognitive decline, Alzheimer's, and having certain bacteria profile, because we have the ability to do PCR tests to be able to identify different key players in that pathogenic bacteria spectrum. So between looking at oral bacteria as well as bacteria in brains post-mortem.
Have you seen or read about any examples of people that had um, been found maybe during life to have this bacteria in there? Is there any remedy for that, or this is all once they're deceased, then they're doing these examinations?
Well, because there's evidence of this, there's a number of modalities out there. One is called the Bredesen technique, which is a Dr. Dale Bredesen looks at treatment, reversal, and prevention of Alzheimer's. And one of the tenets of treatment and prevention is reduction of oral pathogenic bacteria, as well as looking at sleep health and many other micronutrients and other aspects of health, nutrition, and things. But it's a matter of in life to be testing for these oral bacteria and treating the source of it by treating the gum disease and trying to reduce the bacteria. Some of the bacteria can be very resistant.
Wow, I'm gonna guess there might be some people listening wondering, are these bacteria floating around in my
Well,
brain?
well, there's a number of oral salivary tests out there,
Hmm.
and we test a lot of our patients so that we can target what kind of treatment we recommend with regard to their oral health. It helps to guide us on which products to use and what type of periodontal treatment they may need. And if there certain bacteria are not there and they have mostly a healthy bacteria, then we have other recommendations on how to try to keep it that way.
Hmm. I have heard, but I'm curious to know your opinion. Is it true that there's a whole different group of bacteria that are on, let's say, the roof of the mouth and the teeth versus the
Yeah.
tongue? There
Yeah,
is. Yeah,
there
yeah.
and the sinuses and the
Mm.
nose and um the skin. And we just had a interesting a lecture with a local scientist doing some research in trying to change the metabolism of the pathogenic bacteria so that they don't secrete acid and things. And she was telling us how in their studies, they're finding that some of the bacteria from the mouth, actually, if they treat that, there's been a decline in urinary tract infections, skin infections. And so these bacteria can migrate around. Um, so they may start and have a different biome in the throat and the nose, but they can travel.
Sure. Super interesting. My wheels are spinning about
Mhm.
getting some testing done and
Yeah,
trying to get a
it's
sense
very
of
interesting.
what's
It's very
going on because
interesting.
you don't know until you're testing and you're looking at things. Well,
Hmm. Hmm.
that's a lot to think about. How about just as far as you've given some great examples already as far as relationships of oral health to brain health and to also osteoporosis as well. How about just general longevity? Do we have any data about a relationship to somebody's lifespan slash health span in relationship to their oral health?
Well, there's a number of statistics that are really just staggering. Like, for example, I'm just going to read a couple here. Heart attack, 50% of heart attacks and strokes are triggered by oral bacteria that get into the cardiovascular system. Up to 50% greater risk of cancer with gum disease. More 70% of people are more likely to develop Alzheimer's if you're suffering more than 10 years from gum disease. Um, so gum disease releases toxins into the system, inflammatory cells. It actually, these oral bacteria can shuttle lipids right into the lining of the blood vessels. Um, so in the realm of longevity, when you look at the relationship of some of these conditions, I think that speaks pretty closely to, overall longevity, that oral health and sleep and breathing health is really impactful as far as longevity.
And I think what's exciting about that, I mean, not that those numbers are exciting, but just this idea that we have so much that we can do for our
Hmm.
oral health. It's something
Right,
within our locus of control in a
right.
world where there's so much that
Hmm.
we can't control. I mean, we can't
Right,
control the exposure to environmental toxins all the
right,
time and the car exhaust fumes and just all the
right.
many things that are surrounding
Yeah,
us. But
yeah,
this seems to be one thing
right,
that has so many different areas of positive benefit for the body that we can absolutely control and can
right.
have huge ramifications for our health.
And and it is simple lifestyle things like reducing sugar. The amount of sugar consumption also over the last 50 decades has really increased. And and that really causes a shift in the oral microbiome, as well as increases risks for gum disease and cavities, tooth loss, and as well as obviously other metabolic issues. And then when you look at just other nutritional things that people can do, other reducing processed foods and those chemicals as well. They all feed the good bacteria and encourage their growth versus favoring the bad bacteria. So the bacteria need a good diet from us as well.
Sure. Yeah. I'm curious, is there any data that relates to, let's say, cane sugar versus high fructose corn syrup versus stevia and its relationship to either cavities or oral health?
Well, fructose, glucose, cane sugar, maple syrup, processed, I mean, it's sugar, and the bacteria in the mouth will ferment it and release acid, and it doesn't really matter the source.
Mm,
Even the sugar from, good and healthy things can potentially be problematic. If a person is sucking on a lemon in their water all day, the low pH of the acid, it can erode the enamel. So I guess sugar is sugar. Stevia and other non-nutritive plant-derived sugars, they don't have the same metabolism. The bacteria doesn't have the same metabolism, and they're not karyogenic. But it's interesting because I was just talking to a patient earlier today, and we were trying to figure out why he was getting erosion and cavities. And it turns out that he was sucking on a lozenge uh, to help with dry mouth. And it said tooth friendly, and it had, I think, stevia in it. So that was fine. But we were looking up the product, and it has an acid pH of like 2.5.
mm,
So it's like sucking on an acid. And so sometimes we have to look at the ingredients of sugar, and pretty much, all kinds of sugar can be fermented and can be problematic. But we also have to look at pH of some things, beverages and, lozenges and other things like that. They can have a dangerous pH that can erode the minerals in the teeth as well.
sure. How about tea? Where does that fall as far as pH is concerned? Is that,
Oh, you can look up, I mean, coffee is got a lower pH, and actually some, black teas and green teas, they can have some health benefits. But then again, it's how you're drinking some of these beverages too. Like if you sit with a glass of cup of coffee or a cup of tea, and there's an acid pH, and you eat breakfast and it's down the hatch, it's going to be less detrimental than if you're sitting and sipping it over a period of an hour. And that's kind of also where some of these lozenges can be problematic too. If, it's 30 minutes for a lozenge and then, the next one goes in too. So then it's a constant bathing in either sugar and or acid.
Do you have any insights or thoughts about feeding window, just from an oral health standpoint, not from, let's say, a metabolic standpoint,
Hmm.
but is there maybe an ideal amount of time that a person should have in between meals and or beverages that are, let's just say, not water?
So a healthy saliva, which not everybody's saliva is healthy because sometimes as people are taking more and more medications, certain medications can reduce saliva. And sometimes with age, sometimes salivary flow can decrease as well. With mouth breathing versus nasal breathing, it can reduce saliva. So normal saliva will take about 30 minutes to neutralize something that's acidic and sugary, but that's normal saliva. So if you've got somebody with compromised salivary flow, it could take longer, quite a bit longer. So if you're constantly nibbling, snacking, and it's not so much the volume, but it's kind of the time that you're actually, exposing yourself and your saliva to having to keep neutralizing this. Does that help answer your question?
Yeah, absolutely.
Yeah.
Interesting. Well, let's switch gears a little bit. And this is a question that I often ask people. How has your notion of aging changed, both as you have aged as a person, but also gained more insight as a practitioner?
Mm. Well, I know that the notion of aging really has changed for me in that I now look a little differently at age span versus health span.
Sure.
And now I'm aiming at trying to make those things align.
Hmm.
And many people now live longer, but statistics are that the last decade of their life is consumed with managing illnesses, and then the quality of life suffers. So it's not too late to improve your health. And I feel it's important to find and partner with a team of practitioners that resonate with your healthcare goals, and both with prevention and identifying, root causes of things. So that's kind of what's changed for me is, you know, um, trying to have a health span that matches a long lifespan.
Absolutely. The goal is that we go until we don't go, and that's
Yeah.
not this prolonged uh miserable end, that's for sure.
Mhm.
What about any, as far as your personal routine, any non-negotiables that you have for your health, whether that's certain amount of sleep or type of exercise or dietary things, what do you consider so vital for your own health that you're gonna do them no matter what?
Well, I'm on a healthcare journey myself. I feel like I'm kind of a human petri dish and experiment. And so that is an interesting question because what I might say may be something I'm working on myself. And I can't put it in the past tense of saying, I always do this. But I would say that it's important to do what you love to do in everyday life and that you're passionate about. I also think it's important, not negotiable, to be active in any way that works for you. And I'm getting more and more respect for eating healthy foods, and don't wait until symptoms get worse. Disease and health, I feel like I've said, are on a continuum. And people don't just wake up one day with type 2 diabetes. It can take years of metabolic syndrome to progress until it's diagnosed as diabetes. But I'd say, just in general, act early in the continuum to prevent the progression of a disease.
Yeah, don't wait until the car is
Mhm.
broken down on the side of the
Right,
road. Keep
right.
the
You
oil
know,
changed and the tires
and
rotated.
and if your fasting blood sugar is, 99, you don't wait for it to be 100 and then you have diabetes. Something shifting. And then you know, lab results have normal values, but maybe not be optimal. So I'd say to be curious and question and act early.
Yeah, I think that's really wise advice. You've you've talked about a lot of different statistics. Do you have any resources that you might be able to
Oh yeah.
link people
Yeah.
to?
Yeah. I belong to a number of organizations, American Academy of Oral Systemic Health and American Academy of Physiological Medicine and Dentistry. And I have a number of um, uh, informative flyers and things that I can upload that people can access that have some of these pieces of information and statistics.
Cool. Yeah, I can put a link for that for those that are interested in checking
Mhm.
that out. They can find those and have those. I think that's excellent. How can people find you if they're interested in learning more about root cause dental and the type of care, the holistic care that you offer people? Where can people find more information
Um,
about that?
the website is rootcausedental.com, and we're in St. Louis Park, Minnesota. And when the website was created, it was created with a lot of really good information on it. So the website can be really a good, tool to learn some more too.
Awesome. Any last parting words of wisdom or bits of encouragement that you would have for people, particularly with regards to their oral health?
Um, I would say that the mouth being the window to the rest of the body, um, things that in the past that I've looked at and just treated the symptoms can be some signs of some other things that require and suggest maybe some further checking into. So things like clenching teeth, TMJ pain, changes in person's bite, acid reflux, they can all be signs of disturbed breathing patterns at night. So that's one thing I would just say, just like diabetes, sleep apnea, sleep disturbed breathing, don't just appear out of nowhere.
Mm.
It's on a continuum, and that some of these subtle signs, it may be okay to treat the symptoms, but that requires and suggests a little bit more digging as to what's the cause behind it.
Well, that's awesome. I have learned a lot, and I have known you for a couple of years, and I think every time I talk to you, I learn a little bit new. So that's
Thanks.
awesome. I so appreciate taking the time this afternoon to sit down and share some of your knowledge with folks. And as you described, people can find you at the website. And I wish you a long, this happens to be a Memorial Day weekend. I wish you a long, happy, and restful weekend, and we'll talk soon.
And thank you. Thanks for the opportunity. Thank you so much.
Yeah, you're welcome. Bye now.
Bye.
Well, thanks for listening all the way to the end. Episode number 2 with Dr. Gross. I hope you found it as enjoyable as I did. If you're interested in learning more about Dr. Gross and her dental practice, you can visit rootcausedental.com. And if you're interested in learning more about the Better with Age program, you can visit www.betterwithage.online. This is a program that I developed to help teach people how to improve their strength, bone density, balance, gut health, brain health, sleep quality, everything that we need to be able to live a vibrant and healthy life. So if you're interested in learning more, go to www.betterwithage.online. Lastly, we're recording this on the Friday before Memorial Day weekend, and I just wanted to express my gratitude to all the servicemen and women that have sacrificed so much to be able to give us the freedoms and the ability to have our hot dog parties and picnics and all the things that we often take for granted. So on behalf of the Better with Age team, we salute you and thank you for your sacrifice. Have a great weekend, everybody. This is Galen signing off.